The mass vaccination campaign continues. Every day, we are working tirelessly to get as many doses as possible, as quickly as possible. Last Friday, we announced that millions of doses of Pfizer's vaccine will arrive earlier than anticipated, including 1.5 million doses before the end of March. As a result of this news, we are increasing our total number of vaccines received against COVID-19 before the end of March to 8 million doses. I know it's a lot of numbers and calculations, but the important thing is this. Vaccination is accelerating significantly. An ever-increasing number of people are getting vaccinated, including a lot of parents and grandparents that you can't wait to see again, and frontline workers. And every day, more and more people are being protected.
Right now, across the country, we're getting vaccines to Canadians. We now have 4 vaccines approved by independent regulators in Canada, more than any other country. Again, you can count on the fact that any vaccine approved in Canada is both safe and effective. Last week, we received almost 1 million doses of COVID-19 vaccines. This week, we're getting another 1 million. And before the end of this month, we will have received a total of 8 million doses of COVID-19 vaccines. On the 500,000 AstraZeneca vaccine doses delivered from the Serum Institute last week, these shots are being distributed to provinces as we speak. More and more people are getting vaccinated every day. That means more grandparents, healthcare workers, and vulnerable people are now safer. Our top priority is to get you your shot as soon as possible. No one will be left behind. Just take Myrtle from Kanawake, Quebec. She's 90 years old and was the first elderly person living at home in Kanawake to receive a vaccine. For Myrtle and her family, getting her shot was a big moment, because now she'll be able to tell her sons who call every Sunday that she is safer.
The last year has not been easy, but despite everything, it is important to remember that we have reasons to remain positive. For example, yesterday was the International Day for the Rights of the Women. It was a time to stop and celebrate the achievements of women in all their diversity here in Canada and around the world. Unfortunately, it was also a time to remember that the consequences of the pandemic have been more pronounced for women and girls. This crisis cannot be allowed to roll back all of the social and economic gains women have made over so many years. In order to rebuild better, economic recovery must be a win-win situation for everyone.
Yesterday, Deputy Prime Minister Freeland announced the creation of the Task Force on Women in the Economy. This 18-member task force, from CEOs and childcare advocates to labour representatives, economists and Indigenous leaders, will advise the government on continuing to advance gender equality in the wake of the pandemic. We need to rebuild an economy that's fair for everyone. So that's exactly what we're going to do. Of course, this is just one part of the equation. After all, it's almost impossible to get, let alone keep, a good job without a roof over your head. Everyone deserves a safe and affordable place to call home. Yesterday, the federal government partnered with the government of British Columbia to announce a $517 million housing benefit investment over 10 years. This is part of our $2 billion commitment to the Canada Housing Benefit to support families right across the country. For more than 25,000 households in BC, the new Canada-British Columbia Housing Benefit will provide financial assistance to marginalized people with low incomes to help with monthly rent. On average, this could mean around $400 in support each month in rent. This program is designed to get right to people who need it most. That's why the benefit will go directly to households through non-profit housing providers through BC Housing. Investments like this are real steps forward to make sure that everyone has a safe place to call home. I want to thank Ministers Ahmed Hussein and Joyce Murray, Member of Parliament Terry Beach, and their counterparts in BC for all their important work on this issue. Jeudi cette semaine, 11 mars,
On Thursday this week, the 11th of March, it will be 1 year since COVID-19 was officially declared a global pandemic by the WHO. In a short time, our lives have changed. What seemed normal the day before was going to become less and less normal in the weeks and months that followed. This week, you've been making sacrifices for a year. To all Canadians who make efforts big and small, I would like to say thank you. I know it's not easy. This is the kind of crisis that happens only once in a century. We will get through it by being united and by continuing to work together. We've come a long way since last year, and there is still a long way to go. But we're going to end up defeating COVID-19.
we're naming March 11th, 2021, as a National Day of Observance to honor everyone we lost to this terrible virus and to recognize the impact this global pandemic has had on all our lives. Around the world, more than 2.5 million people have died because of COVID-19. 22,000 of them were our fellow Canadians. They have been taken from us, but they will not be forgotten. Each one was special. Each one was loved. They were grandparents, friends, parents, brothers, sisters, and colleagues. There are no words for the pain of losing someone you love. As a country, we remember all those we lost, and we mourn with families and friends. To everyone who is grieving, we're thinking of you, and we're there for you. On Thursday, I invite all Canadians to join together to honor the memory of those we have lost and to thank all those who continue to make incredible sacrifices to fight this pandemic. Together, we will beat this virus. Merci. Je cède maintenant la parole.
Thank you. I now give the floor to Dr. Tam and Dr. Njoo.
Bonjour à toutes et à tous. This week
Good morning.
marks the 1-year anniversary of the World Health Organization's declaration of the COVID-19 global pandemic. As we update the latest numbers, let's not forget that the impacts have gone far beyond the numbers. During this long and difficult journey, we are continuing on together. To date, there have been 890,698 cases of COVID-19 in Canada, including 22,276 deaths. There are now over 30,300 active cases across the country. Over the past week, an average of over 2,900 new cases and 37 deaths were reported daily. During the same time period, over 2,080 people with COVID-19 were being treated in our hospitals each day, including almost 550 in critical care. This weekend, as I reflected on the week ahead, I felt a mix of emotions that I'm sure most of us are feeling in one form or another. First, in looking back at the year behind us, it is a time of solemn remembrance of the cherished lives we have lost. At the same time, it is clear that our work is not done. To honor the memories of those we have lost and appreciate the progress that our sacrifice has afforded us, it is time to pause to remember, gather our strength, and commit to our future by sustaining our efforts until the crisis phase of the COVID-19 pandemic is behind us. In remembrance, the Government of Canada has designated this Thursday, March the 11th, 2021, as a National Day of Observance to commemorate those who lost their lives and the significant impacts we have all endured because of COVID-19. As we reflect, it is also a time for great hope, given many important advancements. Not only have we all learned about the public health measures and individual precautions that work to reduce the spread of rapidly spreading respiratory diseases like COVID-19, but our efforts have held the force of infection at bay long enough to buy time for research on vaccines and treatments. It would be very easy to take for granted the incredible worldwide and population-wide effort that has brought us not one, but multiple safe and effective COVID-19 vaccines. In fact, the timeliness, safety, and effectiveness of these vaccines was not a given. And I would say it has in many ways exceeded the hopes we dared to have a year ago. We have all experienced loss, and I know we're all tired. But let's also recognize some of our achievements and the good things that we want to carry forward. We can have renewed faith in ourselves coming together during a crisis, sticking it out longer than any of us might have guessed we could do, and doing it with enduring kindness. Though there have been stumbles, we have adapted and we have endured, and I know we have what it takes to see things through. Lest I leave you without a public health reminder, as we continue to accelerate vaccinations, having the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible, and wearing the best fitting mask will continue to serve us well. Thank you.
Bonjour à toutes et à tous.
Good morning. This week marks the one-year anniversary of the World Health Organization's declaration of the COVID-19 global pandemic. As we update the latest numbers, let's not forget that the impacts have gone far beyond the numbers. During this long and difficult journey we are continuing on together. To date, there have been 890,698 cases of COVID-19 in Canada, including 22,276 deaths. There are now over 30,300 active cases across the country. Over the past week, an average of over 2,900 new cases and 37 deaths were reported daily. During the same time period, over 2,080 people with COVID-19 were treated in our hospitals each day, including almost 550 in critical care. This weekend, as I reflected on the week ahead, we felt a mix of emotions that we are sure most of us are feeling in one form or another. First of all, in looking back at the year behind us, it is a time of solemn remembrance of the cherished lives we have lost. At the same time, it is clear that our work is not done. To honor the memories of those we have lost and to appreciate the progress that our sacrifice has afforded us, it is a time to pause, to remember, gather our strength, and commit to our future by sustaining our efforts until the crisis phase of the COVID-19 pandemic is behind us. In remembrance, the Government of Canada has designated this Thursday, the 11th of March 2021, as a National Day of Observance to commemorate those who lost their lives and the significant impacts we have all endured because of COVID-19. As we reflect, it is also a time for great hope. Hope, given many important advancements. Not only have we all learned more about the public health measures and individual precautions that work to reduce the spread of rapidly spreading respiratory diseases such as COVID-19, but our efforts have held the force of infection at bay long enough to buy time for research on vaccines and treatments. It would be very easy to take for granted the incredible worldwide and population-wide effort that has brought us not one, but multiple safe and effective COVID-19 vaccines. In fact, the timeliness, safety, and effectiveness of these vaccines was not a given, and I would say it has in many ways exceeded the hopes we dared to have a year ago. We have all experienced loss, and I know we are all tired, but let's also recognize some of our achievements and the good things that we want to carry forward. We can have renewed faith in ourselves coming together during a crisis, sticking it out longer than any of us might have guessed we could do, and doing it with enduring kindness. Though there have been stumbles, we have adapted and we have endured, and I know we have what it takes to see things through. Lest I leave you without a public health reminder, as we continue to accelerate vaccinations, having the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible and wearing the best fitting mask will all continue to serve as well. Thank you.
Thank you, Dr. Njoo. We'll now turn it over to questions for the media. We'll start on the phone and then come back to the room. Just as a reminder, the Prime Minister will be here for a number of questions, and then the doctors and Minister LeBlanc will be available as well. Operator.
Thank you. Merci. Première question, Raymond Filion, TVA. À vous.
Question. Good morning, Prime Minister. You've always strongly defended multiculturalism and diversity, so I'd like to know how you react to allegations of racism in amongst the royal family. I believe that in Canada, we've demonstrated that we have no tolerance for racism or systemic discrimination. My government and myself have recognized the existence of systemic racism, and we've made significant steps to fighting this racism in all of our institutions and all of our systems. I will not comment on the royal family, the British royal family, but here in Canada we will continue to fight systemic racism.
We have been very clear as a government that we will always stand up against systemic racism and intolerance in all its forms. I have recognized, our government has recognized systemic discrimination and has moved forward significantly to fight against it as it exists in all our institutions and all our systems. We need to be vigilant, and we will continue that work. I won't comment on what's going on over in the UK, but I will continue to endeavor to fight against racism and intolerance every single day in Canada.
What do you say to the many people here in Canada for whom the time is ripe to rethink our ties with the monarchy, especially following these allegations of systemic racism? My priority is to fight against COVID-19. It is to rebuild our economy better than it was before, and our efforts as our government is aligned on that and on the coming as quickly as possible of vaccines. Constitutional dialogue can happen in some places, but my absolute priority right now is the health and safety of Canadians so that we can beat this pandemic.
Right now, my single most important priority is getting through this pandemic and rebuilding the economy. Everything we're doing every single day in terms of keeping Canadians safe, of getting vaccines here as quickly as possible and into as many Canadians' arms as we possibly can, is our singular focus, along with preparing the economy to come roaring back as quickly as possible. I can understand some people are looking for constitutional conversations. I'm not going to engage in those right now. I am focused on getting us through this pandemic.
Merci. Prochaine question, operator.
Thank you. Merci. Next question, Cormac McSweeney, City News. Line open.
Prime Minister, there are reports that the government will not be presenting a budget in March, that it will be later this spring. Can you confirm whether or not we will get a budget by the end of the month? And what is your government's justification for not presenting a fiscal plan this month, given the fact that we haven't had a budget since 2019?
We will be announcing the date of the upcoming budget in due course, but I can tell you that we are focused very much on getting us through this global pandemic that has been the challenge that we've faced for a full year now. We have put forward measures repeatedly, including fiscal updates and significant investments in Canadians, from families to workers to small businesses, and we will continue to do absolutely everything necessary to get us through this pandemic as long as it takes. That's the promise I made to Canadians, that we would have people's backs every step of the way, whether it's on income supports, whether it's on the housing benefits we've announced today, whether it's on getting them vaccinated as quickly as possible. We are working on the budget. It will be coming soon, but we will have an announcement to make in due course.
Follow-up, Cormac?
The military has announced that we have a new Vice Chief of Defense Staff, Francis Allen, Lieutenant General Francis Allen, the first woman to hold that role. How important is it to have a woman in that role at this particular moment in time, given the misconduct allegations against people in the senior ranks of the military? And will the government set up an independent body to investigate accusations of sexual misconduct, racism, and discrimination?
I think from day one, this government has been very clear that appointing women to positions of leadership throughout the government, starting with a cabinet that is gender parity for the first time in Canada's history, to appointments throughout our government that demonstrate how important it is to get to gender parity. I am very pleased to see a strong woman in the vice chief position for the first time in Canada's history. And obviously, the tasks of everyone in senior leadership in our military is to move forward on ending the challenges of harassment and discrimination in the military and in other systems, as well as ensuring that anyone who comes forward to share stories or allegations is given the support and resources that they need.
First of all, as a government, we've always shown the importance of placing women in positions of power. It began with our equal cabinet, but also in our appointments throughout government over the past 5 years. Many women, racialized people, minorities have been elevated because diversity is essential for the good of our country. With regards to the armed forces, I expect all leaders to fight against bullying, harassment, and various types of aggression. Having a woman for the first time in that position will be very important to continue our fight in eliminating discrimination and bullying within our armed forces, and to make sure that we have the necessary resources to offer support to all those who have concerns.
Merci. Prochaine question. Alberta.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse, à vous.
Question. Good morning, Mr. Trudeau. The Bloc Québécois has asked you to make mandatory hotel quarantines for everyone, including people who arrive by land, because some people cheat. They fly to Burlington, for example, and then they simply just take a taxi or a bus across the border. What do you have to say to the Bloc? We have for 1 year nearly put some of the strictest measures for international travelers here in Canada in the world. We have 2 weeks of quarantine. That's been the case since the beginning. We don't accept non-essential travelers or residents to come to Canada. And that has been the case for a year now. For a number of months, we have implemented measures to test people before they come back to Canada, and now they can be tested when they do return. We are examining the effectiveness of all of our different measures, and indeed, there are different measures for people who arrive from the skies and those who arrive over land. We are confident that our best practice-based decisions and expert-based decisions are the right ones to keep Canadians safe. Yes, a follow-up question. Would you say yes or no, and why? Answer: I think it is essential to ensure that the measures we implement are the right ones with regards to people's health and safety. These measures must also be doable. They must be implementable. We are always open to suggestions to do more, and we will examine the bloc's suggestions.
Prime Minister, it's the first time we've had a chance to ask you about the news we reported a couple of days ago that someone who wanted to provide some information about Admiral MacDonald was threatened. And so I'd like to hear you comment on that. And then following on that is, what steps have you or the government taken to give comfort and surety to those who may have some information about some of these investigations and are nervous about coming forward? Can you speak to that?
Thank you, David. It is absolutely unacceptable that anyone who would come forward to share allegations or preoccupations around incidents of harassment or assault in our military or anywhere else be faced with intimidation themselves or threats. That is something that I condemn in the strongest terms. Everyone needs to feel comfortable in being able to come forward with concerns or allegations, and there need to be the resources and supports there to make sure they are heard and that those allegations are followed up on, respecting the wish of those people who come forward. It is extremely important that anyone who works anywhere in Canada, particularly for government, particularly anyone who's chosen to serve in our armed forces, be supported and listened to. We will continue to move forward on measures to ensure that we are not only giving those supports to people who come forward, but also ensuring that we're putting in place independent mechanisms to put an end to these troubling allegations and this behavior once and for all. C'est absolument inacceptable.
It is wholly unacceptable that anyone with allegations of harassment or assault be themselves victim of bullying, intimidation, threats, or harassment. No one who shares that kind of accusation should be subject to that. I condemn these reports. In the most strictest terms, we have to ensure that whomever comes forward is listened to, is supported with all measures required so that we may move forward with independent investigations, depending on the will of the people or the person who has made the allegations. We must respect survivors. That must be at the heart of everything we do. And of course, we will continue to move forward to offer better support to all those who have concerns to share, but also measures to put an end to this culture that allows or tolerates bullying and harassment within our institutions in Canada.
Oui, bonjour, Laurence Martin, Radio-Canada.
Laurence Martin, Radio-Canada. Question. You've talked about independent inquiries. Will there be such an inquiry into these sexual harassment allegations in the army? If yes, why didn't you do it earlier? Because these allegations have been on the table for years. Answer. In many of our institutions, the Armed Forces, Correctional Services Canada, with a number of recent reports, the RCMP, with the Bastarache Commission, we have seen cultural problems of tolerance, of harassment and abuse, which is unacceptable anywhere in Canada. We will and we are examining various measures we can implement to ensure that, first of all, there is true and tangible support to those who come forward with complaints and allegations of harassment, but also we have to implement measures to change our institution's culture throughout the country. And throughout our workplaces, we have made progress, but there is still work to do. Of course, we will examine all the various reports and recommendations that have been made, and we will act.
I think what we're seeing over the past days, weeks, and months is a really troubling pattern in Canada. Whether we talk about the news coming out of the Canadian Armed Forces, whether we talk about the Bastarache report into the RCMP, or even recent reports coming out of Correctional Services Canada, we see that our institutions in Canada are not doing a very good job either of preventing a culture that tolerates harassment, intimidation, and even assault, or puts forward measures to support anyone who comes forward with stories of harassment, intimidation, or assault. This needs to end. There have been, as has been pointed out, numerous reports and recommendations made on measures that can be put forward to do that. We have taken steps as a government in that direction, but there is more to do, and we will do more.
A follow-up question. There have been allegations for years in amongst the armed forces, and so this request for an independent inquiry has existed for years. So why have you not acted? Looking at this from outside, it seems that you've waited for a scandal to act. Answer, au contraire. We have moved forward with a greater number of measures and a better structure to better meet allegations that have been set forward to transform our culture with Operation Honor, for example. What we are currently seeing is that changes that have been brought forward have not been enough and were not quick enough. We will do more.
I think we have taken significant measures over the past number of years in Parliament with C-65 around our armed forces with a number of recommendations. We've moved on from the Deschamps report. We're moving forward on measures within the RCMP, and we've moved forward on measures within Corrections Canada. But what is obvious is that those measures didn't go far enough and they haven't moved fast enough. And that is my commitment, that we will be moving faster and going further to make sure that anyone who serves their country or works for the government or ideally works anywhere in Canada has a safe workplace and recourse if they are unsafe.
Prime Minister Lieber Thiem, Canadian Press. Parties left and right of yours are calling for more targeted supports for sectors that will likely be last to emerge from the pandemic. Why are you resistant to this idea?
We have, from the very beginning, delivered on our promise to Canadians that we would be there to support people as long as it took, as much as it took. That's something that we've demonstrated. Of all the money invested in helping Canadians get through this pandemic, 8 or 9 of every $10 has come from the federal government. We have been there. And these supports have been targeted to the most hard affected sectors. Airlines have received over $1.5 billion in supports. Tourism operators have received support through the wage subsidy, through the CEBA. There have been many, many different supports that have gone to the hardest affected sectors, and we've further extended those supports. We have announced supports in our fall economic statement, and we certainly hope that parties in the House, particularly the Conservative Party, will stop playing games, blocking and obstructing the passage of important legislation from medical assistance in dying to measures to support families. We know it's important that our democracy continues to function, that we continue to have robust debate around all these measures, but even the NDP and the Bloc are now pointing out that the Conservatives are being obstructionist in the functioning of Parliament. We need everyone to work together to be able to continue to deliver the supports for Canadians that they so richly need in this difficult time, even as we approach what is hopefully the end of this pandemic with the arrival of mass vaccinations.
Prime Minister Tom Perry from CBC. I know you don't want to get involved in a constitutional debate. I know you don't want to comment on the royal family. But I would like to ask you, how do you reconcile your support for the monarchy with your stated desire to dismantle the legacy of colonialism in this country?
There are many institutions that we have in this country, including that big building right across the street from us, Parliament, that has and is built around a system of colonialism, of discrimination, of systemic racism in all of our institutions. But the answer, Tom, is not to suddenly toss out all the institutions and start over. The answer is to look very carefully at those systems and listen to Canadians who face discrimination every single day and whenever they interact with those institutions, to understand the barriers, the inequities and inequalities that exist within our institutions that need to be addressed, that many of us don't see because we don't live them. That's what fighting systemic discrimination is all about. Listening, learning, and improving and transforming our institutions. We have been open to that. We have been working on that from the very beginning. Obviously, I wish all the members of the royal family the very best, but my focus, as we've said, is getting through this pandemic. If people want to later talk about constitutional change and shifting our system of government, that's fine. And they can have those conversations, but right now, I'm not having those conversations. I'm focused on getting us through this pandemic and bringing our economy roaring back.
I believe that it is very important to understand that we live in a system with institutions that were built not for everyone, but only for the few. And over the years, yesterday we recognized that it was not even 100 years ago that women were given the right to vote. We still have a lot of work to do to eliminate discrimination and systemic racism in our institutions. But that doesn't mean that we simply have to cast all of these institutions aside and then start from scratch. What we have to do is take a good look at our existing systems to remove existing barriers and inequities. The way to do that is to listen, to really actively listen those for whom this system is unjust, those who suffer from personal and systemic discrimination, so that we can learn to do better. I wish the best to the royal family, but my priority right now is to transform Canada to be more fair, just and equitable. Just a better Canada for everyone.
Prime Minister Mackenzie Gray with CTV News. On vaccines, Johnson & Johnson has told the EU that they'll be under stress to meet their second quarter targets for vaccine supply. Has the company told you there'll be delays in Canada? And can you give us at least a ballpark date on when we can expect our first Johnson & Johnson shot in Canada?
First of all, we are very pleased to be one of the very first countries to authorize the Johnson & Johnson vaccine. With the approval of Janssen, we're now one of the only countries in the world with 4 major effective vaccines approved for use in Canada. We have heard in many conversations with Johnson & Johnson that there are challenges around production of the Janssen vaccine, but we will continue to engage with them, and we look forward to receiving doses as soon as possible. And as soon as we get confirmation of doses being sent to Canada, we will let everyone know.
Thank you, and that concludes the time the Prime Minister has. The doctors and Mr. LeBlanc will be available for questions in just a moment, and we'll start over on the phone once Prime Minister leaves.
And that is the Prime Minister of Canada today. We're going to pull away just briefly to wrap up some of the remarks that he made today with my colleagues, David Cochrane and Catherine Cullen. I'm going to start on the issue of sexual assault and sexual misconduct inside the military, David, because he was asked a number of times whether the government had done enough. Obviously, the naming of a woman to a vice CDS role is significant, but that's not going to solve all the problems. And he had some pretty strong words on that front.
Yeah, there's a lot of changes happening inside the Canadian military as it sort of deals with this crisis, right? I mean, General Vance was gone. His replacement's been forced to step aside. And now there's allegations of controversy swirling around both of them. Lieutenant General Frances Allen is now the new Vice Chief of Defense Staff, moving there from her job as Canada's representative to NATO headquarters. A significant moment to have a woman in that job, but also at an important time given everything that's happened. The Prime Minister had a lot of criticism for the military, the RCMP, and Corrections Canada, essentially saying that they're not doing a good job of preventing incidents of improper behavior or supporting people who come forward to make complaints. And he says there needs to be more resources and supports along those lines to protect people. Also reacting to a report from our colleagues at Global News that someone who wanted to sort of raise concerns about Art McDonald faced threats and intimidation after they tried to do this. The Prime Minister talking about the need for resources, talking about the need for supports, stopping short of a full-blown agency being created, though there are reports from our colleagues at the Globe and Mail that the government has concluded it needs to create an independent agency to deal with allegations inside the armed forces independently, to take the reporting and the investigation of sexual harassment allegations outside of the chain of command. Now, whether this is simply an agency to deal solely with harassment allegations, or it's more of a broader inspector general type position, as has been recommended to deal with racism and discrimination inside the armed forces. The Prime Minister nodded in these directions with his answers there, but did not give a clear definitive answer, because it seems like they know they need to do something.
Yeah.
I'm just not sure they've landed on the precise answer just yet.
Yeah, as far as he would go was independent mechanisms, without going a little further on what that would mean. Just because we don't have a lot of time, Catherine, I'm going to get you to weigh in on his remarks about the royal family and systemic racism. I thought our colleague Tom Perry did a very capable job with an excellent question and got a fairly thoughtful response.
Well, a really interesting answer, because, of course, there was that question to the Prime Minister right at the beginning of the news conference, sort of trying to get him to engage on some of these questions around the monarchy. And he essentially saying, listen, that's not what I'm focused on right now. But when Tom came back to him at the end of the news conference, he really did expand, saying, listen, a lot of our institutions have, colonialist past. There's systemic racism involved. The solution is not just to toss out those institutions. He said there are conversations going on right now about getting rid of the monarchy. Right now, I'm not having those conversations. So the Prime Minister did make it pretty clear there. He's not interested, certainly at this moment. And I think politically that's probably wise. Most people very much focused on COVID. While that interview with Oprah might have been entertaining, perhaps their primary focus, not the monarchy itself. But basically, I think pretty ultimately dismissive of the idea of severing Canada's relationship with the monarchy. But the Prime Minister, going back to themes that we have heard from him before around questions of systemic racism, saying, we need to do more, we need to do better, we need to improve the institutions, not simply get rid of them. And that, I think, has interesting ramifications, certainly for the monarchy, but also when we broaden those discussions too to talk about other institutions like policing that the Prime Minister's been asked about in the past.
Okay, I'm going to leave it there just because the press conference is ongoing. Thank you both very much, David Cochrane and Catherine Cullen, for your help with our coverage. Obviously, there were some sadder words off the top, commemorating almost a year since the pandemic was called a pandemic by the WHO. But for now, let's take you back to the press conference with public health officials and Minister LeBlanc. Suhana Marchand will pick up our coverage after that.
Because it's an important subject, your government said that it would be preferable to move forward consensually, given the sensible aspect of this subject. We recognize that this is a sensitive subject, of course. This is literally a question of life and death for Canadians. That is why a number of times we've proposed to extend parliamentary debate, and before us we also have the reality of a decision that was made by the Quebec Superior Court that states that we do not want different systems from one province to the next. The Parliament has spoken a lot about these questions, but when it comes to procedural matters, it is the leader in the House that will give you a better answer. And I'm sure that he will no doubt have things to say over the next few days on the matter.
Right?
Question. In an answer earlier, you said that Canadians expect Parliament to work and that Conservatives are obstructing adopting certain economic aid measures. The Prime Minister seems to be saying the same thing. Do you believe that it would be possible for Parliament to sanction or to continue rather for 1 year, or are you telegraphing the fact that perhaps you may be seeking a stronger mandate soon? Well, Marie, I believe that we have been very clear. Canadians are not looking for an election and do not want an election during the pandemic. Canadians expect Parliament and parliamentarians to work together, and I believe that we have done well over the past year. Parliament, the House of Commons and the Senate adopted a huge number of very important measures to support Canadians in the context of this pandemic, and it's the work that we seek to continue. We would like to work with opposition parties. We recognize that we are in a minority situation, so we must collaborate with colleagues in the House of Commons to find the best way for us to support Canadians in the current economic context and this current public health context. And that is the work upon which we focus now. We also understand that Conservatives have, for a number of weeks, shown the will to delay and obstruct the likelihood that the House of Commons can actually progress. Democracy starts and ends with a vote, and so let us allow the House of Commons to vote and express itself. It is work that we continue to try and do with all opposition parties, and we are very lucky to have Mr. Pablo Rodriguez, in his current job at the moment, because I believe that he will find a good way to collaborate with our colleagues in the opposition.
Thank you. Next question, operator.
Thank you. Merci. There are no further questions registered.
Excellent. Thank you. We'll turn to the room. David.
Thanks very much. This is a question for Dr. Tam. Of course, Dr. Njoo, if you'd like to join in as well. It just comes back to the issue of the intervals between the two-dose vaccines. I'd like to get your thoughts on this. There's a letter circulating from researchers at the University Health Network that says extending that interval is a bad idea, and that follows up on what Brad Wouters, I don't know if you know Brad, he's in charge of research at UHN, and he tweeted last week, there are no data. Nobody in the world has been 4 months between doses. These are RNA vaccines never used before. We should use evidence to make decisions. Canada is conducting a population-level experiment. Could I get Dr. Tam to comment on this debate in the scientific community, and how should Canadians interpret this?
Yes, so I think you've seen the recommendations from the National Advisory Committee on Immunization on increasing that dose, extending that interval with the primary objective of providing a safe and effective first dose to as many people as fast as possible, and then coming back with that second dose is not a one dose strategy. And I think their recommendation comes in several steps, if you like, that we can sort of unpack a bit. First of all, is increasing evidence of the efficacy, the effectiveness in real time gathered from different countries as well as domestically of the effectiveness of that first dose. And the interval or the amount of data that was gathered really amounts to about 2 months and counting. Every day you get a bit more information on that interval. And at that point in time, the effectiveness is high. And so at the 2-month interval, when the effectiveness is high, it is not expected that that kind of protection will suddenly disappear overnight. And so the committee looked at, well, what would happen to that immune response based on existing knowledge about vaccines and immunology already in place. So if that level of immunity is not expected to suddenly drop, increasing the flexibility of the ability of the provinces to deliver that first dose, which is really safe and effective to as many people as possible to prevent deaths and hospitalizations, is paramount at a point in time where, as I said, we're in a bit of a delicate situation when the epidemiology is that we still have thousands of cases a day, hospitalizations and deaths. This was felt to be the most important objectives. And on top of then the NACI recommendations, as you've seen, the chief medical officers and the provinces really embrace that approach. And lastly, is that, of course, the real-world data and the surveillance of vaccine effectiveness will continue to be gathered by experts such as those from the BC CDC, Dr. Danuta Skoronsky, Dr. Gaston Dessert from the INSPQ. We have the capacity in Canada to monitor that over time. Lastly, of course, as supplies increase, we suddenly got really great news on Friday of some additional forwarding of the Pfizer vaccines. Then that interval is not to say we have to give it at 4 months. It's just as fast as you can possibly give that second round. So that is a strategy, and that is a consensus position from all the chief medical officers.
Covering the advertising campaigns of politicians back and forth over policies. But given this debate, the uncertainty, we have Anthony Dale, the president of the Ontario Hospital Association, saying that, quote, to engender trust and confidence within the healthcare system and the general public, we need more from the Public Health Agency of Canada, the Health Canada, advertising and engaging in public relations beyond just maybe tweets, to tell Canadians about this interval issue and perhaps to, I don't want to say combat, but to present your case versus other researchers who have different views on this 4-month interval issue. Can you speak to how you can get your message or get a message out to Canadians to explain to them about this 4-month interval issue?
Yeah, so I think communication is always really important. And I do think we can do more in all facets of communication. So as you've seen that in the light of need to move rapidly in a public health context, as new information keeps coming in, there will be many different voices looking at the same data in different ways. But you're right, there needs to be more engagement and more communications. And that's not just public communications or doing press conferences. I think it is engaging communities all the way down. Health professional groups, we have been engaging different health professional organizations. We need to continue and do more of that. And also communities writ large. And I think that speaks to not just the question of the interval, but overall in terms of all the questions that I have about vaccine effectiveness and safety. And to that effect, I think some of the more innovative approaches has been this Vaccine Community Innovation Challenge that was just launched to award different community-based organizations into providing trusted information to their own communities, which is really important. So, of course, we need to translate the NACI recommendations, which, by the way, will keep evolving. That's the challenge, is how do we keep communicating evolving recommendations to the public and different communities in real time. So you'll see some of those other innovative measures, but you're right, it's not just about public communications. Community engagement is really important, and we all need to do better at that.
Mackenzie Gray here from CTV. I've got two questions for either Dr. Tam or Dr. Njoo. Yesterday, the CDC came out with recommendations for people who are fully vaccinated about new guidelines about what they'd be able to do. I'd like your opinion on two things they said to give guidance to Canadians who are fully vaccinated. One, they said people who are fully vaccinated can meet inside, no social distancing, no masks, with other people who are fully vaccinated. And in the same vein, they said that elderly people who are vaccinated could meet with their grandkids, give them a hug, spend some time together inside again, no social distancing, no masks. What would your guidance be for Canadians who are fully vaccinated?
Well, I think it's really important that we, again, adapt our measures when it is safe to do so, while considering, as I've just said, the evolving scientific evidence, but also expert advice and balancing risks and benefits. And I think, what I will say is that together with the other chief medical officers, we'll be constantly assessing not just vaccine coverage, by the way, but the risk of transmission at the community level. We have considerable community level transmission at the moment, although things have improved. We don't know what the variants are about to do and whether we can keep control on their spread at the same moment as the vaccine coverage is just beginning. So I think we need to take a thoughtful approach, but it is important that we have to evolve our public health approach as more Canadians are getting vaccinated. So I think our key message is keep your current personal protective measures for now, and then we will, together with other chief medical officers and our experts, to provide evolving recommendations. I do think the CDC recommendations are quite sort of precautionary. They're just talking about, private settings and very specific kind of situations when people are fully vaccinated. And so we will also be looking at some of these kinds of adjustments when it is safe to do so. But as you've seen, jurisdictions are just beginning to ease some of the more sort of restrictive measures in the community. So they need to know what is going to happen next. Can they keep the transmission at bay while boosting their coverage? So I think we just need to be very thoughtful about how we do it, but we do need to evolve as time goes on.
You've talked a lot about once people are fully vaccinated, the risk of hospitalization is near zero and that no one has died who has been fully vaccinated from the trials. So when you are fully vaccinated, if you do end up catching COVID-19, how concerned should you be either for a family member, concerned about an elderly person who might get that, or for yourself once you're fully vaccinated?
So there's individual protection, which is really important. And I think we've basically seen the effectiveness of all the authorized vaccines in protecting against serious outcomes. What we do not know, and there's still limited evidence, but it is evolving, we'll get more, is how vaccines prevent transmission. So even the most effective vaccines are not 100%, and you don't know how well protected individuals are. So I think for the time being, as I said, it's important to keep up with these measures. But over time, we will have more information that shows what we can do in the context of people who are fully vaccinated. But I do think in Canada, the strategy is get as many people vaccinated as fast as possible. Because if you imagine you're a senior and you've been vaccinated, but outside of your home or your individual context, the pandemic is escalating, or if other people are not vaccinated, then the risk and benefit ratio has to be sort of looked at. So, but the key piece so that we are all in a better footing is to get truly as many Canadians vaccinated, as many people in Canada vaccinated. I'm not just talking about Canadians, anyone in Canada vaccinated as fast as possible has got to be really our focus.
Yes, this question is for Dr. Tam as well, Liber Theme, Canadian Press. I just wanted to follow up on what you were talking about there. One thing that you said was, this whether vaccines are preventing the spread of COVID-19. I'm just wondering if we've seen any evidence, any early evidence. You seem to say that information is still being collected, but if you have any early evidence of whether vaccinations are preventing or in any way curbing the spread of COVID-19 as well as preventing serious illnesses.
Yeah, so I do see the initial positive signs that vaccines, for example, some of the mRNA vaccines have been rolled out earlier on, but also some of the clinical trial data that will still keep coming out, is that there seems to be some effect on preventing infection for some of these vaccines. So there's early signals, but the data needs to continue to be analyzed. But, I do think that there's going to be some impact. To what extent that impact would be still remains to be seen. Right now, the goal is reducing severe outcomes, but we do have to look ahead now to, what will be the next steps in terms, given as the data comes in. But there are some early signals that some of the vaccines will, partially at least, prevent transmission.
And I wanted to ask whether Canada has any evidence that the variants are spreading more rapidly in this country. What are we seeing in terms of trends with the variants?
Yes, I didn't give my usual sort of numbers update today, but we now have, I believe, over 2,000 identifications of the variants of concern in our positive cases, which means that the numbers are going up. There's definitely signs of community transmission, particularly of the B117 variant from the United Kingdom. In Ontario, for example, they've articulated that 30% of their positive identifications now are due to variants of concern. Lower in other areas of the country at the moment, but I think this is a very present risk for us. So what we have to do again is to ease things really slowly and then, make sure that testing and sequencing capacity is there. As we slowly move towards spring and getting vaccines up and running, what I would say is that the capacity for screening for variants has greatly increased in Canada, to the extent that the majority of provinces, vast majority, are screening or about to get the capacity to screen 100% for very specific mutations. And then sequencing has also improved greatly. And so, that's a good foundation. But we'll just have to watch really carefully as to what happens in the next couple of weeks, because many provinces have just began easing, and we will know, pretty soon, I think, as to whether we are able to keep the variants at manageable proportions while vaccines are escalated, which is why now is not the time to sort of make too many shifts in the public health measures at this time, but we will be able to do so based on what actually happens next.
Hi, it's Tom Perry from CBC. Vaccine hesitancy has been kind of an issue we've been talking about for a while. I'm wondering, as the vaccines are rolling out across Canada, how much of that you're seeing, how many people you're seeing who are just refusing to take these vaccines. And I'm wondering if, when you're setting up your modeling, if there's a number that you sort of look at, an estimate for how many Canadians will just, under no circumstances, agree to be vaccinated.
Yes, so of course there is many different sources of information in terms of vaccine uptake. So first of all, people do surveys, sort of public opinion research. And what we're seeing is that more and more people in Canada are saying they want to get the vaccine. So I think partly it's because we've seen some pretty great results domestically and internationally, and that we have detected no safety signals of concern. So we've now given vaccines to quite, people would say not that many, but quite a few, we're now into the millions of people getting vaccinated. And the long-term care outbreaks have reduced. The seniors, particularly those over 80 that have been the prioritized group, we see their rates dropping and crossing, all the other age groups in terms of how well they're doing with both case counts and serious outcomes. And so with that in mind, I do think that there's an actual increase in the number of people who want to get vaccinated right away. There are some who still want to wait a bit and there's questions, we have to be able to answer those questions. But that's the trend that we're seeing, which is great. Secondly, is that there's been a very high uptake in certain settings like the long-term care facility residents, and in many cases over 90%. In the territories, you will see a high uptake, and they're moving ahead really fast as well. And so, with that in mind, I think that's a positive trend. We still, of course, need to continue to address the remaining questions that people have all the time. And we just talked about the challenges of communicating, evolving information as we go along, as we gather more information. So that is always, one aspect that we have to make sure we do well in order to maintain that public confidence. And the other aspects, which is getting community leaders, getting individuals who are trusted within those communities, continue to support the vaccine programs. We actually have seen quite a number of the leaders in Indigenous communities, in other communities, religious leaders. They're all actually beginning to support some of this, and we've been giving them the information and tools that they needed. And so I think to me, we're definitely in a more positive trend from a vaccine confidence perspective.
And I just had a question for Minister LeBlanc, if he's still there.
Sure, go ahead, Dom.
Oh, hi, Minister. I'm just wondering if you can give us an update, if there's any progress in terms of establishing a process for choosing a new Governor General, where that stands at this point.
Sure. So as I had said and had hoped that we would have something to say in terms of a potential process to recommend the next Governor General a couple of weeks ago. I think we're getting closer. The one element that remained to be finalized, I understand, is concluding. So I hope very soon we're in a position to talk about a potential process. I think it's also important to note that the Chief Justice has been acting as the administrator because the office of Governor General is vacant. So we feel some obligation for the process to generate the appropriate recommendation in an expeditious time. But we'll have more to say on that, I hope, literally in the coming days. I understand that I'd said that 10 days ago, but I think it's imminent.
Can you offer any detail about that last sort of piece of the puzzle you're talking about?
No. As I say, we'll have good. It's a nice try, but no, we'll have something to say, I hope, soon. But we recognize the importance of proceeding expeditiously, because it's an unusual circumstance to have Chief Justice Wagner acting as the administrator. So we're conscious of that responsibility.
Thank you, Minister LeBlanc. Thank you, doctors. That concludes today's press conference.